I'm Dr. Jennifer Prezioso, and I am the founder and CEO of Balance Foot and Ankle Wellness Center. So I opened Balance Foot and Ankle in 2017, and at that time I had already been practicing for several years in a hospital setting, and I was starting to have a desire to feel a little more connected with my care team and my patients that I was treating. And I wanted to develop an organization that offered things that I felt were missing a little bit from a larger healthcare setting. It was always a passion of mine to develop a patient-centric approach to patient care delivery that was aligned with modern healthcare and wellness, and I wanted to be able to provide an environment where patients could expect that high-quality care with a focus on hospitality, compassion, and empathy. And part of my goal was to be able to make this model accessible to a broader range of patients in a larger geographic area, which is essentially why over the past few years I have prioritized growth and expansion in Northeast Ohio. And although private practice has many challenges, especially competition from these ever-growing and integrating health systems, there is something very rewarding about being able to choose your colleagues, to choose your partners that are like-minded, who really have the passion for delivering that same patient-centric care. We support one another to ensure that each patient has the most personalized and individualized care possible. One of the beautiful things about independent practice is the autonomy that each physician has to develop and hone their particular skills without a lot of administrative burden and bureaucracy. First and foremost, we take a comprehensive and multidisciplinary approach to care. We are oftentimes treating patients with complex pathologies that may require working alongside other specialties in order to effectively treat them. We are using modern, innovative, and advanced treatment options to ensure the best possible outcomes for our patients. Patient engagement and communication is certainly always a priority. We're using integrated EHR, MyChart platforms, which allows us to have more timely access to patient information, results, communications, secure messaging. We offer telemedicine visits at all of our locations. We have translation services, and we can really be reached. We're accessible if necessary after hours. And for non-urgent issues, patients can email us directly right from our website. Those emails usually get answered within an hour or so when they're received during business hours. We also make every effort to ensure that when a patient calls, they speak to a human, or they get a call back as soon as possible that day if they do indeed have to leave a message. This is truly one of the benefits that we see from a smaller independent practice. We have an incredible staff that's always willing to adjust in a pinch and be flexible. The physicians want to be able to just take care of their patients who need us when they need us. When we need to change or evolve our policies and procedures, maybe trial new technologies or new products in the office, we physicians can come together as a group and decide what is ultimately best for patient care and best for our practice as a whole, which ultimately benefits our patients. When we think of the framework for healthcare delivery, conceptually, there are 4 levels. The first inner core being that individual patient, which obviously is at the heart of this model, or at least it should be. The patient should always be at the core. And then we expand out a little bit and we have the care team. The care team is going to include the physicians, the mid-level providers, the patient's family members, friends. And if you expand even further, you're going to see the infrastructure, the resources, the clinics, the hospitals, the surgery centers. And further out that last level is the environment in which we're delivering the healthcare, the conditions under which we operate. And what I try to do as a physician leader for our organization is at least try to focus on the inner core factors and the outcomes in these innermost layers of prioritizing the individual patient, focusing on our care team, and our clinical infrastructure. This is where I think independent practitioners can really shine and dial in on delivering that individualized care to patients. This patient-centric model allows that patient to become an active participant in care delivery rather than just a passive recipient. Healthcare is constantly changing, and what we are seeing for the future is a continued trend towards more outpatient services, as well as more healthcare delivery of service in the patient's home. There's a real possibility that in the future, the hospital bed is going to be in the patient's living room. House calls are going to be via video chat. We are also looking at a continued trend and shift towards value-based care, in which doctors and hospitals are rewarded or compensated for delivering high-quality patient care while attempting to decrease costs. So the goal in value-based care is to provide incentives for good outcomes and meeting the needs of the patients. As the CEO of an independent practice, I spend a lot of time reading and watching these types of trends, even on a national level, because these shifts and trends are going to impact all of us and ultimately impact my strategy and the decisions that I make every day for the future of our practice.